CNA Exam Materials. Welcome to the quiz. Question 1. Recognizing signs of metabolic emergencies allows for timely intervention in patients with chronic conditions. While assisting Mr. Davis, a 58-year-old patient with type 1 diabetes, with his morning care, you notice he appears confused, is diaphoretic, sweaty, and reports feeling shaky and dizzy. Based on his presentation and medical history, what acute metabolic complication should you immediately suspect? Option A. Hyperglycemia, elevated blood sugar, requiring insulin administration. Option B. Hypoglycemia, low blood sugar, requiring rapid carbohydrate administration. Option C. Hypertensive crisis, requiring immediate blood pressure medication. Option D. Cerebrovascular accident, stroke, requiring neurological assessment. The answer is B. These symptoms indicate hypoglycemia, confusion. Question 2. Maintaining appropriate professional boundaries with patients preserves therapeutic relationships and prevents ethical violations. During a discussion about professional conduct, the charge nurse asks which scenario demonstrates proper maintenance of professional boundaries between a CNA and a patient. Which action appropriately demonstrates maintaining professional boundaries in the nurse-patient relationship? Option A. Accepting a small homemade gift from a long-term resident expressing gratitude. Option B. Sharing details of your recent personal relationship problems with a sympathetic patient. Option C. Using a patient's first name with their permission during care activities. Option D. Focusing care interactions on patient needs without discussing personal matters. The answer is D. Professional boundaries mean keeping the relationship therapeutic and patient-centered. Discussing personal matters blurs boundaries and shifts focus from patient needs. Small gifts may sometimes be acceptable per facility policy, but aren't the best example of boundary maintenance. Using first names with permission is acceptable if it respects patient preferences. The clearest boundary maintenance is keeping interactions focused on patient care without personal disclosure. Question 3. Understanding the chain of infection helps healthcare workers interrupt transmission of infectious agents. During an infection control in service, the educator reviews components of the infection transmission process. The chain of infection model includes all of the following components except which one? Option A. A susceptible host with inadequate defenses against the pathogen. Option B. A mode of transmission allowing pathogen transfer between individuals. Option C. Antibiotic resistance developed through improper antimicrobial use. Option D. An infectious agent capable of causing disease in a susceptible host. The answer is C. Antibiotic resistance is not a component of the chain of infection. The chain includes infectious agent. Question 4. Safe operation of mechanical patient lifts requires systematic pre-use checks to prevent equipment failure and patient injury. Before using a hydraulic mechanical lift to transfer Mr. Williams, a 280-pound patient with complete lower extremity paralysis, from bed to shower chair, what essential checks must be performed to ensure safety? Option A. Verify the patient's current weight against documented information. Option B. Confirm the lift's weight capacity exceeds the patient's actual weight. Option C. Ensure the lift battery is adequately charged or hydraulic system functional. Option D. All of the above checks are essential before using any mechanical lift. The answer is D. All checks are essential for safe mechanical lift operation. Weight verification ensures the patient doesn't exceed lift capacity. Capacity confirmation prevents equipment failure. Battery/hydraulic check ensures proper function during transfer. Missing any check risks patient injury from falls or equipment failure. Systematic pre-use checks are standard safety protocol for all patient handling equipment. Question 5. Interpreting blood pressure readings requires knowledge of current classification guidelines. After obtaining a blood pressure reading of 168/94 mmHg for Mrs. Chin during routine morning vital signs, you must correctly categorize this finding. According to current hypertension classification guidelines, how should this blood pressure reading be categorized? Option A, within normal limits for an adult female patient. Option B, hypotension requiring intervention to raise blood pressure. Option C, pre-hypertension warranting lifestyle modification counseling. Option D, stage 2 hypertension requiring medical evaluation and treatment. The answer is D. 168/94 mmHg is stage 2 hypertension, systolic A per 1,000 yen 140 or diastolic A per 1,000 yen 90. This requires medical evaluation and treatment. Normal is 120/80. Hypotension is typically 90/60. Prehypertension is 120-139/80-89. Stage 2 hypertension indicates significant cardiovascular risk, needing intervention. Accurate classification guides appropriate response and reporting. Question 6. Specialized oral care for unconscious patients prevents complications and maintains oral health. When developing a care plan for Mr. Thompson, who is unconscious following a severe traumatic brain injury, the nurse asks about appropriate frequency for comprehensive oral care. How often should thorough oral care typically be performed for an unconscious, non-responsive patient? Option A, once daily during the morning care routine is sufficient. Option B, every 2 to 4 hours to prevent aspiration and maintain mucosal health. Option C, only when oral secretions become visibly soiled or odorous. Option D, twice weekly unless specific problems are identified. The answer is B. Unconscious patients need oral care every 2 to 4 hours. They cannot clear secretions. Great job! Don't forget to subscribe. Bye.